Hello guys, welcome to my channel. If you are new here, you're welcome. If you're a returning subscriber, you are also welcome. It is your baby girl nurse, life with nurse fresh. I talk about nursing, family and health. Okay, so on today's video I am here to ask you a very beautiful question. The question is, those of you that have not subscribed to my channel, why have you not subscribed to my channel? Why have you not hit the bell notification? Why have you not shared this video? Why have you not liked? Why have you not commented on my videos? Please tell me why. So that is why we are here. That subscribe button doesn't bite. It does not bite. So that is why we are here. No, that's not why we are here. So guys, I am going to be telling you guys about my experience. I'm going to be explaining to you guys a very interesting topic, which is the abdominal CT scan, which is done in my department. Okay, so firstly, it is a good Friday and happy Easter to everyone of you, depending on when this video will come up. But just know it's an Easter vlog. So I was called upon to come and do an abdominal CT for a patient, and abdominal CT is a three-phase procedure whereby we have the oral contrast taking, the enema taking, and the IV contrast. Okay, so I was called to come and do this, and I came. So guys, if you want to know, abdominal CT, it is called abdominopelvic CT, is done to assess the abdomen, its organs and tumor, lesions, infections, injuries, intracranial bleeding, unexplained pain, obstruction and other conditions. You may be asking, why should I do an abdominopelvic CT? When you have an unexplained pain, when a doctor has diagnosed and did not see does not actually know the main diagnosis, the doctor might ask you to go and do an abdominal CT, abdominopelvic CT when diseases affect the internal organs, the abdominal organs. The doctor will ask you to go and do an abdominopelvic CT. So here, this is the water for the oral contrast. I have two bottle waters, 75. But when I use one is when it is 150 cl. That is one big ever water, you use one. But when it's small ever water, you use two. And that is my hydro cord and then my PCM. Sorry for turning it upside down. I was actually recording this but with my voice, but the noise here was too much. And that is my kidney dish. Okay, so as a nurse working in the hospital, you can't do without your glove. You cannot actually do without your glove. And these are my contrasts. The blue one is the injectable contrast, while the green one is the oral contrast. So, and that is my normal saline for enema. I told you it's a three-phase procedure, and that is the enema is the second phase. So I'll start by wearing my glove. I just remembered when we were in school, wearing of glove will take you like 10 minutes. When the procedure station is giving you 5 minutes, just look at how it's entering my hand now. Like shey you can see it have entered sharp. But in school then, when you are doing OSCE, to wear glove you will just spend like 5 minutes when the procedure is just 5 minutes. So like when you are struggling to wear glove, but it is well. We believe in God. We have passed. So I've worn my glove, and that is my kidney dish. You can't do without it because you're not actually going to keep your pre-medication outside or on the floor or something like that. Meanwhile, before I start giving this pre-medication, the prelim, that's pre-examination, will be done on this patient to capture the organ without contrast. Meanwhile, this contrast is a dye that helps to see the internal organ, that helps to see it. Like this contrast will make the system white. Like it's a dye, when you apply a dye, the color of that particular environment changes. So I have my hydrocort. I use 400 milligram on a normal patient, like patient without any condition or something to, for it not to affect the kidney. I use three for the liver, sorry. I use three for this patient, and my PCM 600 PCM, which is paracetamol. 600 milligram of paracetamol and 300 of hydrocort. Okay, so I am actually withdrawing my hydrocort now. Please mind you, when you are withdrawing, be very careful while withdrawing it to avoid wounding yourself. Okay, so I'm done withdrawing my hydrocort. I'm trying to expel air from it. I'm giving it intravenously. That is why the doctor is needed here. The doctor gets the line with a cannula, and I inject this pre-medication through the IV line. Okay, so I finish withdrawing and I discard my needle. Okay, you discard immediately. Don't try to recap. Okay, so I'm going to withdraw my PCM here and also dilute it. I'll be diluting it with sterile water, which is aqua. I'm breaking it. I don't have that, like people who break these bottles with their bare hands. Like I salute them from I come cap for them. No, I use a faucet to break it, and I'm done breaking. I withdrew. Like I told you, I was going to dilute it. I diluted with this aqua, that is injection water. I diluted it to 10 mils, like got it to 10 mils of that 10 mil syringe, and my pre-medication is ready. Okay, yes, I'm trying to show you guys the aqua. I actually don't withdraw from, I open it then withdraw. It's more easier for me than using a syringe to puncture. Okay, I don't know how you do your own, but that is how I do mine. Then I add my dry swab for the pre-medication to be ready. Like I know that it is now ready. In case there is bleeding from the site, I'll be able to clean it. Okay, so here I was reducing the water from this rubber so that I'll be able to add my contrast, my oral contrast, into these bottles. Okay, and this oral contrast is 2020 per these bottles, but if it is a big ever water, it is going to be 40 mils of oral contrast, depending on the contrast you are using. And some people might use 30, 35, 50, depending too. So it is not like 40 that I'm using is a fixed mil for this contrast. Do you get? So I'll have to put the contrast into these rubbers. This is my contrast, and my glove is actually dirty at this point, so I have to remove my glove, then don another glove. I'm now going to be withdrawing my oral contrast from the container. Depending on the method that is easy for you to withdraw, because it can be frustrating sometimes for you to withdraw this oral contrast. Some people bring out that is it love or what, and they'll pour it in there, then put it back. Very easy for them, but for me it is not easy, because sometimes this contrast might split on me, and it's not going to be good and to hospital management. So I'm trying to withdraw 20 mils of contrast, that was then the other 20 in the other bottle. That is how we do it for oral contrast. Okay, so remember I said it's a three-way procedure, and the third one is that the patient will be given an IV contrast by the machine inside the CT room. Yes. So this one is not done by the nurse, it is done by the machine. That is the third procedure, and it is the final one. Okay, yeah. Okay, so at this point I was done with my oral contrast mixture. This is time for the enema, which is a combination of normal saline and the injectable contrast. Okay, so this is my enema. I'll be using 1.5 of the normal saline. This is one and half. Okay, I'm going to be reducing that. This is me trying to reduce it. It's the giving set. Okay, so in this procedure, the the full normal saline, the one that is filled up, I'll be putting 20 mils of injectable contrast, while the half is 10 mils of injectable contrast into it, so that I will I'll be able to give it to my patient. And remember, when I said enema, it is through the anus. I am actually going to be passing this through my patient's anus. Okay, and at this point of this enema, this patient will feel filled. Remember that my patient took a water, that's oral contrast water, and then this enema. This patient will be filled. You feel like going to the toilet, urinating, passing physics and all the rest. But no, we try to tell the patient to do what? Hold it, so that whenever the procedure is done, like when the procedure is done totally, then the patients can be able to do what? Go and urinate. Okay, so this is my 10 mil. I'm trying to add it to that half of the normal saline, and then the patient will be asked to go and use the toilet. And then after the procedure is done, the patient will be asked to go and use the toilet, because there is accumulation of this water, shit, and every other thing in the abdomen. Okay, remember, this patient does not eat before coming for this procedure, maybe a day before coming for this procedure. So the patient will be asked to go and eat. Then, this is me trying to put my normal saline inside a bowl, then pouring a hot water, like I'm going to make it warmer. Okay, but remember that I am not going to pass this tube just like that into my patient's anus. I am going to be passing it with a catheter, and I'm using size 22 catheter to pass this enema into my patient's anus. I'm trying to open the catheter, then make it sterile. The inside is very much sterile. Yeah, so I open it, then plug the giving set into the catheter for easy access. You get, for me, so that the catheter will be the one inside, then the giving set I'll put it on. Then you understand. So this is what I do for enema. Yes, this is what you can see. That is what I do for enema, and I don't allow that sterile nylon to come out of, like the catheter to come out of that sterile nylon, for it not to be contaminated. Okay. So you might be asking why I did not dispose or throw away that syringe. Yes, I'm going to use it to inflate the catheter when I put it into the anus, for the catheter not to come out. You understand? This is my kettle of hot water that I boiled. I am going to be pouring the hot water into that bowl where I put in my normal saline, so that it will be a bit warm when I am giving it to my patient. So this is actually what I do. I am set for an abdominal CT for my patients. Like, I am 100% ready for my patients right now. And this is actually what I do for any patient that is coming to do an abdominal CT. Another thing you must do is that you must go to greet them, reassure, and all the rest. I am not going to be showing my patient's face, yes, unless it is
under their consent, but I didn't take their consent. As I told you, I came to work, okay, on a Good Friday, so I wasn't on uniform. So I decided to make this video. See the girl now popping. Hey, fine girl, your baby girl nurse is all underscore. It's giving 10 over 10, okay. So this is me saying thank you